This is Professor Ndubeze Okonkwo. This is a short video on chest pain, and I'm making this particular video because of the prevalence of sudden death as relates to chest pain. Whenever you have chest pain, especially if you're 35 years and above, please take it serious. A lot of people dismiss chest pain as indigestion or musculoskeletal pain. While it can be attributed to these two things, the most prudent thing to do is to seek medical advice because sometimes it can be fatal. Heart attack and heart diseases are the commonest cause of death in America, and I believe it's same in Nigeria. Therefore, when you have chest pain, especially if the chest pain is left-sided, it can be on any part of your chest, but if it is left-sided, it makes it most likely to be from the heart. And if you have certain risk factors, it makes it more possible. If you have diabetes, hypertension, high cholesterol, if you smoke, and if you are obese, which is overweight, these are the common risk factors that help precipitate heart attack. So any chest pain, heart attack should be on the list. If you're unable to get to the doctors quickly, consider taking one aspirin if you do not have any contraindication to aspirin ingestion. It can also be angina, which is if you have insufficient oxygen supply to your heart muscles, because there is narrowing of the arteries that bring the blood to the heart muscle, which ultimately may lead to heart attack. So if inadequate oxygen delivery to the heart tissues can cause chest pain, we call that angina. The other one is a pulmonary embolism, which is a blood clot to the lungs. If you are sitting like in a place, or like you are traveling, sitting in a car, in the airplane for a long time, sometimes there's tendency for one to develop clot in the back of the legs that may break out and travel to your lungs and block the oxygenation of your blood in your lungs, and that leads to death. It's called blood clot to the lungs, or pulmonary embolism in medical terminology. That can be fatal and it causes sudden death. The other is aortic dissection, the big blood vessel that supply blood from the heart to the rest of the body, called aorta. Sometimes for some reason, particularly hypertension, can cause the blood vessel to start tearing itself, like you're tearing up a shirt, and it's called aortic dissection. And when you have chest pain, it may be coming from aortic dissection, and the person who may determine it for you is a physician. And they have tools, particularly a hospital that's equipped, where they can do CTA, which is a CAT scan angiography, putting some dye into your body and taking a CAT scan picture, which will show whether you're having the dissection or not. If you're having dissection and it's not treated, it is highly fatal. It kills very rapidly. Other causes of chest pain can be musculoskeletal pain, when they're coming from your muscle or from the bone. It can also be inflammation of the sac that covers the heart, called pericarditis. And then, of course, if you have indigestion in your stomach, it can radiate pain to your chest wall. These are not life-threatening. Pericarditis can be life-threatening, but it's less life-threatening compared to a heart attack or aortic dissection or pulmonary embolism. So please take this as an advice. Anytime you have chest pain, especially if you are above age 35, and you have these other risk factors that I have mentioned, please seek medical help. It can be life-saving. I hope this helps.